Welcome back to Wave Listens Live. We're back for a second segment with Dr. Doug Kane, a.k.a. the Neuropathy Doctor. We talked about neuropathy in that first segment. This time we're going to talk about something a little different, something we've not really addressed here on Listens Live before. And sometimes it's an uncomfortable conversation, but it's an important one. And we're going to get into that a little bit here in this segment.
Yeah, so we've brought a new device into our office. It's called the Restora EMS chair. EMS stands for electromagnetic stimulation. And this device is FDA cleared for treating incontinence and weak pelvic floor muscles. Now, in full disclosure, when I was getting my bachelor's in human anatomy in my early 20s, we talked about it. But as a young man, incontinence was just not on my radar, and even to this day, not so much. But was kind of floored to find out how big of an issue it is. 14% of adult males and 62% of adult females deal with some type of urinary incontinence. Between 8 and 9% of Americans deal with bowel incontinence. Now, we don't typically talk about urinary incontinence in polite conversation. Nobody talks about bowel incontinence, not even with their doctor. So they feel that 8 to 9%, I mean, that's almost 1 out of every 10.
Might be lowballing it.
Exactly, very underreported. But all of this stems from weak pelvic floor muscles. And how this affects men, usually older men, is having to get up out of bed multiple times a night to go to the bathroom, and it absolutely wrecks your sleep cycle. So I'll tell a story here in just a moment about how that has affected one of my staff members. But yeah, so I have 4 female staff members and was surprised to find that all 4 of them at some point have had varying degrees of issues with this. So this device will help strengthen those pelvic floor muscles, and will, get to the situation where you don't have to deal with incontinence anymore.
And we'll take a look at that device. We'll see what it looks like and how it works. But from your end of things, how does it work? How does somebody utilize this through Cornerstone to be able to come in and, again, kind of what we were talking about before from neuropathy, but this is something different to change their life in a way that gets them back to a little bit more normal kind of life?
So it's called a chair. It's the Restora chair. You can see a picture there of it on the right side of the screen. It's kind of round looking. It's kind of a hard plastic shell. You sit on this fully clothed. There's an example of one of my staff members using this. And this device will use the electromagnetic stimulation to cause 15,000 contractions of the pelvic floor muscles in 28 minutes.
Sounds exhausting.
That does. I don't know how long it would take you to do 15,000 Kegels, but that would be awfully hard to do. And the important thing is, so in the pelvic floor muscles, you've got voluntary and involuntary muscles. Voluntary muscles are ones we can contract. But most of the pelvic floor is made up of involuntary muscles that we have no control over. So when people do Kegel exercises, they're only working the voluntary muscles that we can contract. This device will exercise all of them. The vast majority of patients, so the treatment protocol is twice a week for 3 weeks. The vast majority of patients will notice significant difference just after that first treatment. So, and to your comment of it sounds exhausting, yeah, if you went to the gym and did 15,000 reps of anything, so these aren't real deep, real strong contractions. You will feel an impulse. You'll feel like a tapping, sometimes it's described as, and that was one of the things that I asked some of my staff members that did this. How did that feel? Was there any soreness? Because that's the first thing I thought of, and they said, well, you can tell that something's happened. Like if you go to the gym and do the workout, you get a little bit of soreness. They really didn't describe it as discomfort, but they could tell that there was a tightening and a toning of those muscles.
Well, sometimes you come home from the gym and that's the kind of feeling that you kind of enjoy because it feels like you've accomplished something. Exactly. And you're not in pain. You just feel like you've done something to improve your body. Go ahead. Well,
and of course the big side benefit is, you don't have to deal with leaking every time you laugh or sneeze or cough or lift or do any exercises, and it waking you up in the middle of the night to go to the bathroom.
So what does the treatment program look like? Is there anybody that should avoid doing something like this? And who's the good candidate for this?
Okay, so candidates, generally female. Like I said, 62% of females have issues with this. A lot of factors that lead into that. Of course, how many pregnancies you've had, if you're overweight, if you do a lot of extreme exercises. We use this for postpartum retoning. They can start 3 months after having delivered a baby, and that just kind of helps get everything back to normal much more quickly. So it's somebody who should not do this. So since we're doing electromechanical or electromagnetic stimulation, people that have any electronic implantable devices. So I was talking with a gentleman the other day who's having a lot of sleep issues from having to get up in the middle of the night. Unfortunately, he has a defibrillator pacemaker implanted. Anybody that has things like a spine stimulator, bladder stimulator, any of those electronic devices, that's a contraindication. Obviously, if you're pregnant, we don't do that. If you've had hip replacements, so that's a contraindication as well. But for most people, no side effect. It's very comfortable. Electromagnetic stimulation, if you think about an MRI, that's also electromagnetism, and so that's been in wide use since the early 80s. So it's well-founded science. It's comfortable. There's no side effects.
MyDrCain.com. You can also call or text that number on the screen, 812-949-0900. If you call Doug, if you text Doug, I know he'll be there for you. All these different problems, from neuropathy to the incontinence issues that we just talked about. Everyone at Cornerstone is there to help you bring your life back to normal. Dr. Cain, I appreciate you joining us here today.
Thank you very much.
That's all we got today here on Listens Live. We will be back here tomorrow. We'll see you then.